Hello, my name is Daryl Robinson, and today we'll be going over injury prevention and rehabilitation in basketball. So, how do injuries occur in basketball? Basketball is a high intensity sport. It involves sprinting, running, jumping, cutting, and rapid changes in direction. Because of this and these unique movements, basketball, just like many other sports, athletes are constantly moving in several planes of motion, or also known as the transverse plane. These movements often put stress on the lower body and lower extremities, and because of this, athletes are often exposed to lower extremity injuries, especially at the ankle, knee, and hamstrings for basketball players. What are risk factors in the sport of basketball? Age can often be a risk factor. Athletes that lack proper movement mechanics, right, to prevent injury, or on the other hand, older athletes who might have mobility or range of motion issues. They also might have had a pre-existing injury that can affect them as well. For gender, it can be, let's say, for women, they have a higher risk of tearing or straining their ACLs than men. So gender can play a role, right? Whether male or woman, male or female. The environment can play a role. So a slippery basketball court, a dusty basketball floor, or even certain type of footwear that an athlete has on can be a risk factor in this sport. I also wanted to include muscle imbalances and poor strength because those can also be risk factors for athletes as well. Let's look at our first injury. Injury number 1, grade 1 ankle sprain. A grade 1 ankle sprain is a stretching of ligaments that affect the lateral side of the ankle. The anatomy is the anterior talofibular ligament and the calcaneofibular ligament. The mechanism of injury would be landing on another player's foot when coming down for a rebound or a sudden change of direction causing inversion at the ankle. For this assessment test, we'll do a single leg balance test, work on a neuromuscular control and ankle stability, and we'll also do a weight bearing lunge test. And the treatment for this sprain will be RICE, which would be rest, ice, compress, and elevation. Our ankle prevention exercises. For our affected area, we'll focus on muscular endurance and stability. So we'll go with single leg balance, 3 sets for 30 seconds. Then we'll transition into single left calf raises, 3 sets for 15 reps. And we'll do those for both calves, both feet. For our opposing, we'll focus on strength and compound movement. So we'll do goblet squats, 3 sets of 8 reps with a 30-pound kettlebell. And we'll do Romanian deadlifts, 3 sets of 8 reps with a 30-pound kettlebell or 2 15-pound dumbbells. I just put that in there for filler. In case someone doesn't have a kettlebell to work with. For our ankle rehab exercises, for our affected area, we'll focus on muscular endurance and mobility, and we'll be doing ankle circles, 2 sets of 15 reps, and banded ankle eversion reps will be 2 sets of 12. So that's where the foot will be turning outward, not inward. For our opposing, we'll focus on muscular endurance, so we'll be doing toe walks, 2 sets of 20 steps, and we'll transition into heel walks, 2 sets of 20 steps as well. The ankle circles and band work improve movement, while the toe and heel walks help build strength and mobility. Let's look at our second injury, a knee sprain and its details. A knee sprain can involve damage to an athlete's knee ligaments, such as the ACL, MCL, LCL, or PCL. This injury is often caused by a force that stretches these ligaments beyond their normal range. I listed all of the ligaments that could be affected in a knee strain or sprain, but here we're going to focus on the anterior cruciate ligament or the ACL ligament. That's often one that is often sprained or injured with most athletes that play basketball. So the mechanism of injury here is a sudden change of direction or crossing over. We'll also refer to awkward landing from a jump as an MOI. And for our self-assessment test, we'll focus on single leg squat test, and this will test the stability of the ankle. We'll also do a step down test as well. And the treatment for this knee sprain will be rest, bracing, and physical therapy, making sure that the athlete is doing work with the physical therapist. So we'll move on to our knee prevention exercises. For our affected area, we'll focus on our strength and compound movements. So our squat, we'll do 4 sets of 6 reps. There'll be 30 pounds or 2 15-pound dumbbells. We'll also do step ups. It'll be 3 sets, 8 reps each leg. which would be 30 pounds, or 2 sets of 15-pound dumbbells. For our opposing, we'll also focus on strength in our posterior chain. So we'll do Romanian deadlifts, 4 sets, 6 reps with 40-pound kettlebell or 2 20-pound dumbbells. And then we'll do reverse split squats, 3 sets, 10 reps with 40 pounds or 2 20-pound dumbbells. And these exercises, they focus on strengthening the quads, the glutes, and the posterior chain. And movements like squats, step-ups, and RDLs, those help improve and control and reduce stress on the knee. For our knee rehab exercises, for our affected area, we'll do straight leg raises, 2 sets, 12 reps. For our terminal, we'll also move on to terminal knee extensions, and with those, we'll do 2 sets, 12 reps. And our opposing, we'll focus on a hamstring curl with the band, and we'll do 2 sets, 12 reps. And then we'll also do mini squats, which would be 2 sets, 10 reps. And rehab exercises like the straight leg raises, terminal knee extensions, those help build strength, while the controlled squats help restore the movement patterns safely in the knee. For our third injury, let's look at a hamstring strain. So a hamstring strain can be a stretch or a tear of the hamstring muscles. In basketball-related injuries, we often see this occur during players attempting to accelerate or decelerate. We just witnessed this recently with the Lakers star point guard Luka Doncic. This usually happens during eccentric loading when the muscle is lengthening under tension. The anatomy of the hamstring details be the biceps femoris, semitendinosus, or the semimembranosus. I'm sorry, I kind of still struggle with pronouncing those. The MOI would be a sudden acceleration or deceleration, or athlete landing awkwardly from a rebound. The assessment test would be an active straight leg raise test or a standing toe touch test. And the treatment for a hamstring will be rest and gradual return to activity. Being that hamstrings are so tricky and they can get re-injured very easily, rest is like a very big thing for athletes during the recovery period. For prevention exercises, we'll focus on the affected area with the strength focus. Again, you can see I like Romanian deadlifts. We'll do Romanian deadlifts, 4 sets, 6 reps with 40 pounds. And we'll do Nordic hamstring curls with 3 sets, 6 reps with their body weight. For our opposing, we'll focus on compound movements with another strength focus. And so we'll do walking lunges, 3 sets, 10 reps each leg with 30 pounds or 2 15-pound dumbbells. And we'll also do goblet squats with the kettlebell, 3 sets, 8 reps with 30-pound kettlebell. And these exercises focus on strengthening the hamstrings and the surrounding muscles. The RDLs and the Nordic curls, they build strength, while the lunges and squats, they improve the overall movement and control. And so for hamstring rehab exercises for the affected area, we'll focus on hamstring isometric holds, 2 sets for 10 seconds, glute bridge holds, 2 sets for 15 seconds. For the opposing, we'll focus on bodyweight squats, 2 sets for 10 reps. And we'll also focus on reverse lunges, 2 sets, 8 reps for each leg. And again, thank you for sticking with me through this. But this is the injury prevention and rehabilitation in basketball. Thank you.